Well, we're here in good old Wilton, Maine, and I wanted to thank you for taking the time to meet with me. I'm with the one and only Brad Dyer, who is the owner of Hometown
Senior Solutions.
Senior
That's okay.
Solutions, yeah.
Yeah.
Tell me a little bit about yourself, Brad, if you would.
So I've been an insurance broker since 2010.
Okay.
I got into that business doing annuity business and didn't really care for it. I didn't sleep well at night taking care of people's money.
Yeah.
And I had somebody tell me I should get into the Medicare business. And what does that mean? It means working with seniors.
Yeah.
And I met the top guy in that business years ago and connected with him, and he taught me how to manage the business. It was like a whirlwind training. But I found after a period of time doing the job that I found myself praying that I want a job where I can help lots of people to make great money.
Yeah.
And didn't realize at that moment that's what I was in. And now 17 years later, we've helped many tens of thousands of people here in the state of Maine. My last agency, we had about 30,000 clients.
30,000 clients.
That was my last agency, and we, the partnership dissolved and the company got sold, and we restarted as Hometown Senior Solutions in Berlin, New Hampshire. And we came back home here to Wilton. We all live in the area, my partners and I. And now we have a number of thousands of clients. I haven't checked recently, so I don't know, but we've enhanced that business, and now we're going to bring that nationwide. So I've been in the health insurance, and I own life license, property and casualty for homes and cars, but I've been in the health insurance primarily for getting on towards 20 years now.
I think you and I have known each other for about a decade, if I'm not mistaken.
Yeah, more so in the last number of years, but
Yeah.
you're even a client at my old business at one point.
That's correct.
Right?
That's
Yes.
right. That's how
Yeah,
it
I think
came about.
you're getting into Medicare.
Yeah. Well, let's see. That was 5 years ago.
Yes, it was. Yeah. So that would have been right
As I was
before
exploring, I
started
don't
this.
think I actually opted in until I was 67. So I've only
Yeah,
been
you were
3
a little
years.
late to the game. If I
Well, no, I
remember.
wanted to wait that extra couple of years so that you don't not limited on your earning.
Oh, you can make you can make your full
Right.
pay without
Right.
being affected by Social Security.
Correct.
Yeah.
Yeah. So you've been involved in the insurance industry. You and I have talked with different insurance experts
Yep.
and one of the biggest problems I'm seeing here in the state of Maine is having affordable health insurance.
Oh, right.
And what options we should be in. I have my idea, but I don't want to talk about my idea. I want to talk about your idea. Although you and I have discussed in theory what could be done to lower the cost and maybe make it so a healthy 18-year-old isn't subsidizing the poor health of someone 60, 65 years old.
It's really what it's become.
I'm not a single payer guy. I don't believe in socialized anything. But let's hear what you got.
Well, so you and I have talked quite a bit.
Yeah.
And it was refreshing to hear somebody that could say, we want people to be helped, but there's a way of doing it that works and that long term makes sense. I'm not a socialized medicine guy. But the reality is Medicare is a socialized program, and it has been since it started in 65. It's here. It is what it is right now, and I personally wouldn't advocate, and I've never heard you advocate for shutting down Medicare, not by any means.
No, by no means.
So with that being said, though, there's a lot that drives the cost in health insurance, and I've listened for years to professionals talk about it's this, it's that, it's the other thing. When the Affordable Care Act came around and became active, I think roughly it was in 2014.
I call it the Unaffordable Care Act, but go ahead.
And when we learn over time that if it's got a positive name for a bill, it probably is a problem for citizens.
Yeah.
So the Affordable Care Act really was about eventually creating fully socialized
Single payer system,
is
right.
fully single payer, and
Right.
I don't. That's not a political thing. That's just fact of reality.
Correct.
And I'm not much for dealing with things in a political way.
Yeah.
So the whole point of that was to make it so eventually the government pays for everything. Well, over time, insurance companies and politicians learned that for all of the interactions they have with money being donated by organizations and people's ideological beliefs is that insurance companies could keep charging more money and the government's just going to keep paying it. It's kind of like what happened with education in America.
Right.
When the government funded everything, the universities just kept jacking the bill up. So you have the Affordable Care Act, which is unaffordable, it should go away. Whether the money goes from the government to the insurance carrier once a person picks an Affordable Care Act plan, or the money goes to the person and then they direct that, to the citizen, and they direct that money to a health plan, there's still a lot that needs to change within health insurance to make that work. And there's been a lot of talk lately about, we need to give the money to the citizen to make the choice.
Right.
Sure. Okay, there's some value.
Well, that's not a bad idea. I think if it can work.
Well, there's some value in it, but anybody I've talked to, in my experience, is if you did that starting tomorrow, the health insurance plans are still the same price. Whether the money comes directly to the health plan from the government or from the government to the person to the health plan, it's still the same price.
Right.
So what's going to drive down the cost of insurance? First and foremost, and Americans aren't going to like to hear this, they've got to get healthier. Utilization, how people use their health insurance, is an important consideration. The sicker we are, the less we take care of ourselves.
Right.
It's going to drive up utilization. That means people are visiting the doctor, hospital, procedures, medicine, all those things. And that is going to inflate. Insurance companies are going to say, well, in order to pay for that, we know as people get sicker, we need to charge more money. But there's also things like guaranteed issue, which we all like. Like, nobody wants to be turned down because they're sick.
Right.
But many years ago, we had high risk pools. So you would take the sicker people, put them in high risk pools.
High risk, yeah.
They would pay more for their insurance, but because the risk was spread out over many different people, it was still lower than if they were just directly insured with a carrier.
Right.
And then the young people could buy catastrophic care plans. Are they
health savings accounts?
Health savings
MSAs.
accounts, right? And those are not investment vehicles, but they do have a component of that allows people to take that money and carry it year to year and have it build value, and then they can push that money into retirement accounts and everything. So there's a lot of structural changes that need to take place in health insurance. And unfortunately, it's just become a big political football, because who out there...
That's the problem.
Yeah, who out there can say, well, no, it's these 10 things, because then you'll have a bunch of talking heads who will say, no, it's these 10 things. There is a reality in the business that if people are sicker, they cost more to care for. Insurance is going to charge more money for sicker people. And when the politicians start fiddling with everything, that's when it goes bad. So we need to bring back high risk pools. No, I don't think we need to bring them back tomorrow.
Yeah.
It needs to be phased in. You got to have high risk pools. You got to make sure that which is going to affect guaranteed issue.
Yeah.
You can give guaranteed issue to a 25-year-old, a 30-year-old, a 35-year-old. But once you start getting up into your 40s and you start getting sicker and you've done dumb things with your body, you're going to start getting evaluated differently. We need to make sure that we're keeping the costs at the hospital level in check. But hospitals they're not for profits generally, but they still have to operate in the black.
They still have to be able to pay the bills.
Right, they still got to be able to pay the bills. And unfortunately, we watch the cost of paying for medical procedures go through the roof. Absolutely through the roof. Why? Well, because the insurance company is going to pay it, because it's going to get paid by the government.
Right, that's it. The government will pay for it.
Right. The number one...
That's the mindset we're fighting.
That's the mindset we're fighting. And you and I have talked at length about... I've told you, our Americans are not going to accept no guaranteed issue starting January 1st, 2027. It's not going to work that way. Now, I think it's something that we have to phase in, but we need to make sure that all the changes that need to get made are going to make it so that if we do have high risk pools to put people in, if we can get the younger people insured cheaper, right? You can't have the sticker shock that'll happen all at once. So this is a I don't know what the time frame is, but it's a longer term solution. But it's going to take leaders, political leaders, and it's going to take leaders within the states and the federal government who are going to push aside the crap and say, what's actually going to get this solved? And that's been my biggest frustration with dealing with politicians over the years. So what we need is leaders in government and in an industry that are going to take a look at what actually works and push aside all the crap that we hear and the emotion, and a lot of this driven emotion, and start making decisions that are going to fundamentally change things in a way that things do become affordable. People can become more healthy, and reap rewards for that, not just physically but financially.
So what do you do with like pre-existing conditions?
Me personally, I don't know that that's ever going to go away.
Yeah.
I'm not saying that we're not going to try, that leaders aren't going to try. They have to have a solution that is going to financially make sense to people, because I've dealt with tens of thousands of people over the years, and it's really heartbreaking to sit in front of somebody who's just been diagnosed with cancer, and that's on a weekly basis. Here in my Wilton office and my other offices, we hear that all the time, and I'm always so thankful that what that looks like is you're going to be fine. You're because the tendency amongst older people specifically, when they're diagnosed with something, well, is my condition going to be covered? Sure, they'll pay $10 million on your behalf, the insurance carrier will, and they won't bat an eyelash. And they're probably going to pass. Unfortunately, cancer takes a lot of people.
Sure.
But
my mom just passed from cancer.
Right.
My brother just passed.
I just lost an ex-sister-in-law from cancer at 45 years old. So I'm not sure I want to see pre-existing conditions go by, and I think Americans are willing to pay for it. But I also think, David, that if we change a number of very meaningful things that are drivers of cost, then people are willing to pay that extra premium because it does cover pre-existing conditions.
Right.
I don't know where that goes, to be honest with you. I'm a very practical person financially, and in making decisions, but because I've sat in front of so many people and watched so many people sick and dying, I'm not sure I want that added to their load of, oh, by the way, and that won't be covered.
Yeah, I know. I'm saying it should be covered. It shouldn't be covered. What I'm saying is, you've got high risk pool, guaranteed issues, and the high risk pool would cover that.
Well, they'd be put into that high risk pool. It used to be
so,
that you could
like
exclude.
you said, I think they'd be willing to pay for it, right?
I do think they'd be willing to pay for it, and I also think
it's a lot more affordable at that point than it is just.
Oh, it's far more affordable. Anytime that you're spreading risk, which is what insurance does,
right?
It spreads risk. You still have to be smart about the numbers. That's why we have actuarials, the bean counters that will say, well, how much high risk can we handle? So there's a solution for that. Let me give you an example. When I get into this business, I was at Rumford Hospital, and that's a critical access hospital, which means it gets a lot of government funding. I had there was a Canadian doctor seeing my podiatrist there, working with him, and they get free health care up in Canada. It's not true.
Yeah.
I mean, they're taxed into oblivion for it, and I personally experienced the Canadian health system. He said, what do you think the solution is, Brad? And I said, I do. I'm not a big government guy, but I do believe it's a quasi-governmental private partnership that's going to solve that problem. And I've dealt with Medicare Advantage plans for this whole time I've been in the insurance business, and that is a private health insurance carrier like the big boys out there, partnering with the government to deliver health insurance plan options. The government subsidizes that, the member subsidizes that, and the plan takes the premium they get between the member and the government, and then provides that care and manages that money. Yeah. And that's worked pretty well, but it still involves the government.
Well, my a good friend, he passed, his name Dr. Jean Labelle. He was the founder of Portland Plastic and Hands. He was a Canadian doctor.
Business, yeah, absolutely.
Right? So he, learned, got his doctorate up there in Canada. It was I called him the Johnny Appleseed of plastic surgery, because he would travel all over the world doing cleft palate surgeries for free. All right, but what the reason he left Canada was because he said they had a death squad, and they would decide, like, so if a guy lost a finger, and he's 35 years old, they figured he could live without that finger instead of paying to put it back on. And he would do the surgeries anyway, and he would get fined by the government for doing the surgery. And he said, look, I've taken an oath and to be in the best interest of my patient, and they wouldn't let him do that. So he left and came here to the United States and founded Portland Plastic and Hands. He was quite the guy. He was one of the nicest people I've ever met in my life. But like you hear these stories about these other places in the world that have great health care. I think we have a great health care here. I think the downfall for us is when we got rid of the guaranteed issue. All right, I think that was a big problem, and then we got rid of what we and the high risk pool. All right, and the high risk pool allowed people who had poor health to get insurance, but it cost them more money. But then but now the way they have it set up is everybody, it's a one size fits all. And I don't believe insurance is one size fits all. I think you're given some people have a good clean bill of health, and some people do not have a good clean bill of health. And I feel sorry for the ones that do not have that are not healthy. But we have to be fair to others and not realize that I'm responsible for you.
Well, if you look at 30 years ago, with high risk pools, people were not healthy, but they were healthier than they are now. So a high risk pool was really made a lot of sense. But when they went guaranteed issue, right, which again, I think it's to get us that step closer to single payer health care, and they just want the government paying for everything. Now everybody's sick, and we run into too many 40-somethings, and as they get older, getting cancer. That's got to change. That's got to change.
Yeah, I think that's got a lot to do with what's in the foods and the diets, and
it's absolutely do what's in the foods.
Robert Kennedy Jr., Bobby Kennedy's doing his job to try and clean that up. But you're right. People only are what they eat, and unfortunately, we're eating a lot of things today that are.
It's so true. We've seen a connection. If you look at your parents' generation, they're hard as nails, and they tended to live up into their 80s.
Right.
Right. If you look at the boomer generation, where a lot of the food experimentation was done,
right,
they're very sick, and they're dying of cancer and diabetes and dementia. Their children, the Gen Xers, I'm a Gen Xer, we're starting to experience the same thing.
Yeah,
that's got to change. And the instances of diabetes are shocking.
Yeah, it's amazing.
It's shocking, and now we've got drugs like GLP-1s where we're, in my opinion, I think we're poisoning people with those things, and we're watching the fallout from people getting sick from those, and drug-seeking behavior from wanting those drugs.
Yeah.
Like searching for pain pills, people are looking for GLP-1s, and they're expensive, and that's driving.
Well, Trump did do something about that
with Trump RX, yeah, right. Yeah. So you can
it's
get
like $35 a dose or something. Or
so
it was ridiculous.
So for insulin, that started a few years ago, and the arguments whether Trump's one that did it or Biden did it.
No, Trump actually tried to get it done before, and when he was president,
and under
the first
Biden
time,
it came through,
and then under Biden it came through, and then people. So they got to get the history.
So
it was Trump that did it. I remember the press release like it was yesterday.
And for the diabetes med cost, that's great to see that come down. But for a GLP-1 on Trump RX right now, it's $199.
Yeah.
Compared to the near $1,000.
They just added another 150 drugs yesterday.
Yep.
Yeah, amendment.
600
Dr. Oz has really been pushing hard, and Bobby K. I think healthcare is a front row. It's in the front row of importance.
Well, it should be, because if you just look at it beyond expense from a national security perspective, we have too many young men and women, and young men specifically, who could not carry a man off the field. Yeah. Let alone run across the battlefield and
yeah, I look at that in amazement, because I'm healthy as a bull.
Well, you grew up and everybody, they had six packs and they were fit.
Yeah.
And I was fit when I was young, and then, I fell into the food window, and so.
Yeah. Well, I've never, I was a bodybuilder, but I never I could never get a six pack.
Really? Yeah.
I look at it.
That's too much work.
No, I would do 1,000 crunches a day, and it wouldn't get a six pack. It just wouldn't do. It wouldn't
think
show.
You need a certain physique to do that.
Yeah, I think so. Some guys, it's mind-boggling. So, I look at healthcare, as a possible future governor here in the state of Maine. Traveled all over the state, talked to a lot of different people. Spent a lot of time talking with you.
Yep.
We had some people we talked and interviewed who, found out that were harebrained, self-centered ideas.
Yeah.
And so you got
well-meaning, but
yeah, definitely well-meaning. But we've got to come up with a plan that makes things affordable. And you and I have spent some time talking about it. And I was at a thing last night, and this was handed to me. They went. It's all about health care for all.
Yeah.
You know, it's like, and she said, "Do you know what this is?" I said, "Oh yeah, I know what it is." And, you know, so I look at these things and I say, okay, it's just ideology, right? And in a perfect world, but you know, we're human beings and our health is not equal.
No,
Right?
no.
It's not. And so some people are just born unhealthy. Some
Yes.
people are born extremely healthy. Some people live to be 100. Some people do not.
There's a lot of naivety to it
Yeah.
as well. When you say, "Oh, we'll have single payer," you know, Ronald Reagan, back before he was governor, as a young man, did a really interesting video on socialized medicine.
Yeah.
And
They did that with GE, right?
I think so, yeah. And it was really well done. And what's interesting to me is personally, I love the idea of never having to worry about paying for a medical bill. Like,
Yeah, but
I think most people would say, well, if I could do it, but people don't understand there's only so much of other people's money, like Margaret Thatcher says.
socialism works until you run
Out of other people's money.
Right? Yeah.
And so then logically you have to put controls on that money. And eventually what that becomes is like what you were talking about with your doctor friend, it becomes death panels. And if people think for a second that with the Affordable Care Act, there is not a version of that, and no, it's not a room full of people in cloaked hoods sitting around deciding
no.
whether Johnny will die. It's the rules. And in a socialized country, if you aren't productive anymore, you don't need to be here. Why do you think Canada euthanizes 12,000 people a year?
Yeah, they make them leave. They'll say, look, if you're not going to, in Singapore, if you don't earn a certain amount of money, they ship you off to Malaysia.
Right. So,
Right, and so because you're a non-productive citizen, you become a burden on society. Now we have millions, you know, probably 30, 40 million people that came here illegally, and we've got that to contend with. And you know what blows my mind about that is that, you know, these unvaccinated, all right, they have no money, no trade, don't speak English, and they're become a burden on society at an unfathomable amount of money. You know, we're talking, you know, probably near $1 trillion.
and they're brought in like we're obligated, and we're
Yeah,
not
but
obligated.
they're coming into our country unvaccinated, and these vaccinations are supposed to be so important. But you know,
Man, that is such a can of worms. Me personally, like, you know, I have health insurance, but I pay a subscription-based doctor, Dr. Mike Champy.
Mike's my doctor.
Yeah, so I have Mike as a doctor. I think, you know, it costs me like $70-ish a month.
Something like that.
To
900, 800 and some dollars a year.
right, and you can pay it for the year. But and this is not a plug for Dr. Champy, but that model, the traditional insurance model, employer coverage. Yes, I think Medicaid, because there are people who just need it. There's never a discussion about just cut off the poor. It's not how it works. It just doesn't work that way. But so I have a variety of solutions that I use because I love the idea of having a doctor I can call, I can actually go see.
Oh yeah.
I'm gonna see Dr. Champy,
Yeah.
and like he says, 90% of what you need I can do here, and where I can't, that's where something like a catastrophic health insurance coverage would come from.
Sure, exactly right.
Right? Or if I do need to see a bone specialist, well, Dr. Champy knows a lot, but he's not gonna pretend to be a bone specialist. He's gonna find me maybe someone in his network of people. So I think if you were gonna like kind of wrap around what needs to be done, we have to look at the regulations in place. We have to look at the laws on the state and federal level, and much of it's driven on a federal level, and look at what we can clearly see as driving expense and driving behavior. So when I'm talking about provider behavior, providers will, I owned a podiatry practice for 5 years, super familiar with how the billing goes, and there's a lot of games that get played in billing, which causes overbilling and inappropriate billing and grossing up bills, and there's a lot that goes on. So we need to look at regulation, but we also need to give people options. You know, and part of what we do at my company is we have options, and one of those options might be, for instance, we had a client in here yesterday that her husband just lost his job of like 20 years, and they're going to go to Christian ministries, and they're cost sharing.
Yeah.
You certainly need the industry experts to speak, but you also need to say, well, wait a minute, I know you say it's always been that way. Well, can it be a different way? And what is that? Can we buy insurance across state lines? I personally don't care if the company is out of like Oregon who wants to provide me a health plan, can they provide me a health plan and follow reasonable federal and state regulations to provide that? And so
Well, that's one of the things I've talked a lot about is buying across state lines.
right. And as governor, one of your responsibilities is going to be make sure to look at what is going on in the state of Maine that would make it impossible for an insurance company to want to come here and do business.
And you look at it, well, I think we have 7 insurance companies servicing us here.
It's a few more, but those are the
How many?
Those are the big boys, 9 or 10.
It is?
Yeah, and so but you have to remember you've not only have employer coverage, which can come from any number of companies. A lot of it around you is Harvard Pilgrim or Anthem or one of those.
Right. Yeah.
But like the Harvard Pilgrims, the Anthems, the Humanas, United Healthcares, the Aetnas, the Marcus Points, all of these companies are either providing a full suite of different insurance products, which may be employer, it may be Affordable Care Act, some marketplace coverage, or some kind of Medicare Advantage plan or Medicare supplement plan.
So let's play around with this a little bit. Now, Brad Dyer, he's the insurance commissioner of the state of Maine, right? And you have the power of the bully pulpit. You have the ear of the governor. And what would you do?
That's a really great question. So I think it's fair to start with there's a lot to know. And I would say in my position, I'm kind of the end user of the insurance system. So over the years, you learn like what are the things that government puts as roadblocks to make things allowable or not. I think my job, if I was the superintendent of insurance in Maine, is certainly going to be to advise the governor on what are the laws and regulations in the state of Maine that I think are either benefiting our ability to get health coverage or hindering it. Yeah. As governor, you only have so much control about when it comes to insurance. You can have employer coverage, you can have control over. Medicare supplement plans, you can have control over. Car insurance and life insurance and all that, you have a lot of power. But when it comes to the biggest payer, the federal government, you don't really have a lot of authority. And I've always felt that I'm on the local school board where I am, and I've always felt that as the politicians, we need to be yakking and yanking in the pant legs of the politicians that go up the scale and say, hey, look, down here where it's all happening, it's not going the way you think it's going. It is not sunshine and roses. It's worse. It's better. And I think as the superintendent of insurance here, I not only need to be talking to my peers around the country, but how are we, I'll give you an example. Medicare went really bad in northern New Hampshire last year. And there were tens of thousands of seniors that were left essentially with only original Medicare because they could not afford a supplement plan. There were no Medicare Advantage plans. And as I started screaming about it, I realized that the local politicians aren't talking to the national politicians. The senators and congressmen are too busy focusing on the shutdown. So we need to do a lot of talking and a deep dive into what are the barriers.
So what are you seeing as some of the barriers?
Well, one of the barriers is the communication. Like I'm saying, at a baseline, is we're not talking enough to our federal delegation, not listening close enough to what needs to be done. I got to be honest with you. Federal government is the biggest payer. They got the biggest programs, and the governors don't really have a lot to say other than to call their federal delegations, to call the president and say, or the secretary, like the Health and Human Services Secretary, Dr. Oz, and to be griping about things need to change. David, I think that the change takes place when the good men and women who are trying to serve the American people get together and start collaborating. It is such a rat's nest of rules and laws and backdoor deals. Yes, those are real. Backdoor deals. And I'm willing to bet, I'd put money that you could only find a couple politicians that could sit there and tell you anything about what's going on with any authority. So it's going to start with a conversation. To tell you that I have all the nuts and bolts figured out, I don't know.
Yeah.
I don't. On the federal level, a lot more. But on the state level, they just don't have a lot of control over what's it's almost like
Well, I
petty
mean,
power.
John Baldacci came out years ago with Derigo.
Yeah, it was a mess.
It was a total mess.
Yeah, it was like trying to
It
copy
was
Romney
modeled, I
care.
think, after what Mitt Romney kind of
Right.
did back in the day in Massachusetts, and he came out with Derigo. I know it was a nightmare.
And the reality is Durgo Health, Romney Care, any of those state-based healthcare plans, those are constitutional. Everything else is not constitutional.
So, what do you think of Trump care, what he's been presenting?
So I think what President Trump is trying to represent is that we need to give the money directly to the people.
Sure.
And at a base,
And let them decide.
and let them decide. If the government is going to subsidize healthcare, because that's exactly what it is.
Sure.
Nobody's going to rip away subsidy right away.
Right.
And I don't think there's any discussion about, well, we'll let them have it now and then we'll rip it away in 5 years. I don't think that's what's happening. You can subsidize it, and I think giving it to the people is a good thing, because then anything that they're not spending and they're putting into health savings accounts, great idea. I think that's awesome. They keep the money, they can use that to pay for co-pays, co-insurances, other things they need. But without a lot of change in federal regulation, dealing with the high-risk pools and pre-existing conditions and the costs of medicine and sick and people being sick, it ain't gonna make a difference, because the insurance companies in the end are just gonna come back and say it's still gonna cost you too much money.
Well, what I'm hearing is that they want to keep the Obamacare around to act as the high-risk pool. Right? And then they would have the Trump care available for the average American at a more affordable price, right?
But you still need insurance companies to provide product.
Provide product,
Right. So for instance, not real, but let's say it was United Healthcare. And if United Healthcare, I suspect, was told, hey, look, we're going to loosen up all of these rules that have kept you from innovating in the health insurance space and creating all of these high deductible plans and a la carte plans. I don't need pregnancy coverage.
Well, why
I don't
does
want
an older
podiatry.
person need pregnancy coverage?
They don't.
They don't. And
They-
so why should we pay for it?
Right.
And we are.
Right. So if they're going to use the Affordable Care Act as the high risk pool, it's still socialized medicine, and I'd say, great, go ahead. You've got the infrastructure all built, land that stuff there, but until product is created and people have choice, because I'm going to tell you right now, the marketplace isn't choice. So the copays are a little bit lower on your primary care visit and maybe higher on your specialist, or they're lower across the board for the primary care visit and the specialist and the things you use the most. But I'm going to tell you, the moment you have a hospital stay, you're going to get it socked to you per day. That every health insurance, that's a numbers game that gets changed every year. They've got to create product.
So what I'm hearing is that you, as the superintendent of insurance, the biggest thing you would look at is what the mandates, regulations are, what's inhibiting the insurance companies from providing more affordable.
Yeah, you've got to look under the hood and see what's going on the state level, and at my level, I can look at laws all day, but it's a rat's nest. It's hard to untangle. So I suppose in that position, the value of that position brings is that you get to call an insurance carrier. They're going to answer the phone.
Yeah.
What's driving this cost? And they'll be real with you. I've dealt with the commissioner, DJ Betancourt, over in New Hampshire, and he's got a real down to earth approach to this. And his insurance market fell apart in northern New Hampshire, and there wasn't anything he could do about it. But they communicate. They ask these carriers, and that I think that'd be the job to do. So, but also I think in that role, we not only need to look at what's driving this underlying, but we got to start talking to others. That's the big thing. I don't think I'll advocate that forever. Is if you're having conversations, it's where you find the real problems.
So advocating for more competition, less regulations, more eliminating as many mandates as possible, high risk pool,
essential benefits,
right.
Which is one thing that drives mandates. So if you tell an insurance carrier who has a template for an insurance product, so if you look at your summary of benefits, That's essentially the template for what they cover, and you go to the evidence of coverage, and that gives you the full detail.
Read the details.
Right, every little detail of what's covered and what's not, and why, exclusions and all that. There's not a lot of exclusions. We need to make sure that we look at these companies and go, hey, throw out your ideas, throw out your product, and so for like you as the governor, or for someone in a position of the superintendent, I'd be looking to say, let's make this the friendliest insurance market we can. What does that look like? What's in the way? And I gotta be honest with you, like I know some things that are in the way, but I think that you'd have to have one good long look under the hood. And there's a lot of value in talking to legislators and the bureaucrats that run this every day. And if you can get them comfortable to say, look, how about we talk truth here?
Yeah.
What sucks? What's driving this? And one thing that drives that expense is main care.
Well, main care is a big problem. There's probably about 6,000 to 8,000 illegals that are on main care. I think if you got 10 toes, 10 fingers, and a functioning brain, you should be able to get a job.
Yep.
I would like to create a stepped program to get them off so they don't lose everything right the next day.
That is so
Right?
important. That's what we run into all the time.
Because and I've said it for the past year. I've said it long before that. Long before I was running for governor, that we have to have a way of weaning people off, not just dropping their benefit.
When you've seen someone, because we help people navigate main care and all that, when you see someone lose coverage that could be life-changing for $1 too much income, when you see a senior lose access to what's called the Medicare Savings Program, which pays their Part B premium, gives them a discount on drugs, a number of things, when you see dollars lose them that opportunity.
Yeah, dollars.
Did you realize that in the state of Maine, if you, David, let's say you were worth $1 billion,
I wish.
and I know that you're Medicare age, right? Let's say you're on Medicare, and you're like, "What's that Medicare Savings Program?"
Yeah.
"Oh, David, it gives you this, this, and this." And I say, "Well, what's your net worth?" And you go, "Well, I got $1 billion in the bank." I'd be like, "Great, you qualify in the state of Maine." You do. In the state of Maine, you qualify for the Medicare Savings Program, and it doesn't matter how much asset, financial or physical, you have. But yet you go to New Hampshire, and probably one of your meals is a dirt sandwich. That would tell you have to be that poor, and maybe you'll qualify for that program that's paid for by the federal government.
So how do they get away with that?
Well, because the states are allowed to determine what the qualifications are for the Medicare Savings Program. So there's so many things. When we moved to New Hampshire and opened our business there, we weren't asked by Sununu, but we wrote an assessment of that benefit alone, just for seniors.
Yeah.
And we got this much response, 0. Maybe it didn't make it to the governor, but then once you find out there's so much bureaucracy in the way there, you need every county to approve it. The legislature in the state of Maine, for instance, can just go change the Medicare Saving Program guidelines, and they don't need any feedback from anybody, just pass it. So what frustrates me is, because I get asked all the time, well, what would you do to change things? I know what I know on the person-to-person level of delivering health insurance and dealing with all the programs intertwine that.
Right.
But there's too much that I personally don't know until you get in there and start digging and going, that's what the problem is. Because in my mind, I don't want to just listen to everybody tell me why they think the problem is. I want to go right down to the foundation and then follow step by step until I see where it went wrong.
Yeah, I mean, that's the same way.
Right. In any good businessman, I know you've been a businessman for a long time.
Entire life.
Right. Longer than me. In fact, I'm suspecting as long as I've been alive.
As long as you've been alive.
As long as I've been alive.
That's a fair statement.
51
Longer
years,
than you've been
that's
alive, actually.
So you're like a spring chicken still. But what you learn in that time is that if you're going to grow your business and you're going to help lots of people, those are the people you're serving in your business, you have to be a problem solver. And problem solvers don't just deal on emotion. They don't deal on legislative threats or difficult legislative members of the legislature. They go find the problem at the bottom, they find out who has any authority, and then they partner with those people to try to solve those problems. And that's what needs to happen in the state of Maine.
Well, you've known me a while.
Yep.
Right? I mean, and you and I have had some pretty deep conversations about insurance, just life in general, and then you believe in the homeschooling thing because the schools are failing.
Yeah, I believe in education in general, but yeah.
So I mean, David Jones is your next governor. What do you think?
I've looked at the candidates, so on the Democrat side and on the Republican side, and I know many of the Republicans, sort of well. I'm going to tell you what I'm looking at. I like the idea of a businessman or woman being in there. I think that's important because the state of Maine, whether anyone likes it or not, is run like a business. It needs to.
You had a new transacting.
Right. It's big scale. It's big dollars, but it's got all the components. And in business, you still get the bureaucrats and the people who have a political way of doing things. I want to make sure I've got a businessman like you in there. I want to make sure I got someone that's got some wisdom. They've been on the planet a while. Yeah. And when you've worked with seniors for a year, you end up having a very high regard for that pattern recognition. Yeah. That someone who's been here a while, and I know that you have that ability to look back. And I've seen that before, and I don't like how that goes. Let me tell you how that goes. I also know that, as I've dug into some of the candidates, I just heard some things that make me really uneasy. And I'm not going to repeat them here, but everybody's got a past, but some things that people have done, maybe they're not so good, and maybe some of the candidates aren't telling the truth about certain things.
I've seen that.
And I saw, actually, I was at a franchise convention last week, and I found one of our candidates might not have been truthful about things. And so here's why I chose to support you. It's not just because I've dealt with you, and it's not like you and I don't hang out on weekends. We're not going to parties together. We're friendly. You're very even keel. You say what's on your mind, and I got a lot of regard for someone who just says what's on their mind. And I got to be honest with you, I don't really care if people like it or not. I don't. Because even though you say what's on your mind, what I know about you, it's not like you're just shutting them down. It's, here's what I believe, but I would love to talk to you about it.
Right.
Because in business, if you don't have the hearts and minds of those people that work for you, you're not getting anywhere. You're not going to get anywhere. And certain things you might go, nope, this is the way it is, and I suppose as governor that's going to be that way. But in that role as governor that you've got to partner with people because the politicians don't work for you.
No, absolutely. I can't fire them.
And right. So I think you're the kind of guy that in there would be like, I certainly believe this way, but what don't I know? Tell me what I don't know.
Yeah, educate.
How do we solve this? How do we stop arguing about this? And I know that you're that guy.
Yeah. I've done that my whole life, just bring people together, and I have an open door policy, always have.
That's the way it should be.
My door's always open.
Right. I don't think that
if God came down from the clouds and we're having a meeting, the door's going to be open.
I would hope so in that case, for sure. But I don't know. I've looked at all the candidates, and like I said, I know enough about them to say this guy is the most even keeled. He's been there, says what's on his mind. We've been on the radio a few times, and we get really free flowing on the radio. Yeah. And I'm not sitting there because quite often I'll sit next to you, and I'm not sitting there going, "Oh, good God, what did he just say?" I look at that and go, you know what? Yep, I think I'm with you on that. So
I'm pretty measured. I like to think about what I say before I blurt it out. And, because once you said it, you can't take it back.
And most of us, if you spend enough time with your thoughts and ideas, by the time you're talking about it in forums like that, whether you're in a debate or you're on the radio or you're doing a press conference, by the time you're talking about that, you've had enough time to spend with it to know what you're saying.
And if you don't, you're not ready.
Right. You're right. And if you don't, and I watched the which debate was that? I can't remember the channel it was on. I watched a couple candidates sound like typical politicians.
Right.
I watched, a lot of the guys were real cool, and they're friendly and everything.
I like them.
They're really likable. But then I watched one just fall apart on TV that and I'm like, maybe that's not a pressure guy we need in there.
Right.
But I don't know. I think you got the right way, and it's not to say that they're not good candidates too, but there's a lot to be said for somebody who has spent their life here.
Yeah, and I'd say, I've been at this for 20 some years now,
Yeah.
talking with politicians, listening to politicians. You know, spent time with President Trump. Followed him around all the debates. I was on stage with the guy. I watched him work. I thought, you know, that's kind of like how there's so many similarities between him and I. It's amazing. But you know, like just being involved in that, and then being on the president, being picked by the president to be on the Republican National Platform.
That's right,
Committee,
yeah.
I was like, oh, that's pretty interesting. And then the Charlie Kirk episode, what happened there, and what I did with him, and you know, I think we have a motto. It's called "Fight Like Hell."
Yeah, I actually, believe it or not, I noticed that for the first time last night when I was looking at videos, and I'm like, how did I miss that this whole time?
Yeah. Well, it kind of came about, you know, after I challenged one of the candidates that wasn't telling the truth, and
I think I remember that.
yeah, I think the whole state remembers that. Right? But you know, it's kind of funny to, you know, at the time people thought, oh, that was no good. You shouldn't. Look, if someone's not telling the truth and they're lying to the people, I'm going to call them out. I don't care who they are, right? And so if I'm not going to be complicit in that lie.
Well, I saw you in the presser you did at the State House the other day, where you in the media, what they focused on was your voting card. Like, what's your ranked choice voting card going to be? And by the way, I love the fact that you didn't just spend the whole time crapping on ranked choice. I don't want it to crap.
Yeah, I've sued the government.
But it's here. It is what it is.
Yeah.
So now we have to work within that system. And you just have a way of just kind of, it's almost like Ronald Reagan. When was he I don't know, was he running against Tip O'Neill? He was running in his first campaign, and he goes, and he says, I know we agreed not to make age an issue.
An issue, right.
He says, so I'm not going to spend time beating up on my opponent for his youth and inexperience.
That's right.
And you have a way of, I'm not calling you Ronald Reagan.
Yeah.
I've been compared to Mr. Rogers, and I'm far from that. But you have a way of just calling it out very directly without being particularly incendiary about it.
Yeah.
It's not
Matter of fact.
it's not really mudslinging when you're saying, well, hold on a sec. This is what you're saying, but it's not true.
Yeah.
This is the case, and I've always appreciated watching you do that.
Yeah.
In fact, I've seen more of it now in your campaign where I've got to see you. You're like, well, you know, like we all know the answer to that, and why are you saying that? I don't want a candidate running for anything who thinks that their persona as a politician and their persona as a person are separate things.
No, they're one and the same.
They're one and the same, and if they spout that crap, that it's not totally different. You know, I like to align myself with people who I know they're going to say what's on their mind, and we won't always get it right, and sometimes we really step on our own tongues. It happens, but in the end, you know that's a stand-up person that's up there. And I got to be honest with you, you haven't asked me to talk about our current governor, but I don't think we have a stand-up person in there.
Yeah, she's gone. She's out of our lives.
Oh, but it's a breath. Yeah, but it'll be a breath of fresh air to have someone like you in there. That again, you may not like what you're hearing, but at least you can walk away and go, you know what? I don't think anybody filled me full of crap.
It's called WYSIWYG. Yeah. What you see is what you get, right?
That's true. Yeah, and, I haven't heard that one yet. That's good.
That's true. I mean, there's no faking it with Dave, and you know, I appreciate you taking the time, Brad. I mean, you're a busy guy, and we're all busy in life, and you know, talking today is important. You know, I think your knowledge about the insurance industry could be helpful to the people of the state of Maine. I think there's, you know, opportunities for us to surround ourselves with great people that, you know, care about Maine, and it's not just about us. You know, it's about everybody. And so I, you know, appreciate you coming. Let me come here today and have a chat with you. And
I want to leave you with one last thing, David.
Sure.
Politicians often go up and say, "Well, I'm going to be the solution to this. I'm going to be the solution to that," and I know what the problem is. And it's important for anybody who's considering voting for you to understand one thing: is that there ain't one of us that has all the answers.
Sure.
If go watch the video I Pencil someday on YouTube, and if you think everybody knows how the sausage is made or the pencil's made, there isn't one person that knows it all. And when it comes to something like healthcare, or health insurance. I'm sitting here as almost a 20-year veteran and telling you I don't know it all.
Sure.
But I know that you're smart enough to, when you see the truth being laid in front of you, you're going to go, yeah, there's a problem there.
Right.
And then you partner with people to sort it out. And I know that's what you're going to do.
Thank you very much.
Yeah.
I appreciate it.
Thanks.
Really do.
Glad you came down.
Look forward to it. It's going to be a fun 4 years, hopefully.
Yep.
And
You're
we'll
gonna
see.
be busy.
Tuesday's the day, and we've got to cast their votes. You can vote. People can vote today.
Yeah, everybody's got to get out and vote.
And Republicans got to understand that. Vote as early as you
They
can.
got to show up.
They got to show up.
They got to show
We've
up.
had 30 days now. Come Tuesday to vote.
Yeah, you don't have a lot of excuse why I couldn't make it because you could have showed up early.
Anytime.
Yeah, that's right. Exactly. Yeah.
Well, again, thank you very much.
Yeah, you're welcome.
All right. Thank you.
Yeah.